Coming back to economy, I want to actually ask you, Mr. Kapil, what advice do you have for the small businesses who are affected with COVID right now?
I think they need to be, small businesses, in my opinion, need to be very careful. They need to spend some time thinking about things as to how they're going to handle. Even when I look at physicians and their practices to a restaurant, so the two different extremes. So for example, physicians they need to have proper protective gear to open up tomorrow, but they need to become a bit creative. So what that means is typically they had a lot of people in the waiting rooms. So instead of having people in the waiting room, people can sit in their car. So people can wait in their car when they come and see the physician, and then they will let your reception know that, okay, here's a name, number, or when they get outside, they can text the receptionist, okay, I'm outside waiting over here, so when my turn comes, please let me know. And so they get texted, so one person goes out, the other person comes in. Things like that. So you just need to be proactive. Same with the restaurants. You need to be careful. You want to maybe position things where you have disposable menus. You have, paper covers for the table and chairs. And maybe your staff needs to be prepared to use, disinfectants on the chairs and the chair handles. You may want to start using disposable, cutlery. Maybe get a fancier one. Look at some suppliers who provide fancier one. You can use that so your clients are comfortable. Or you may want to have open kitchen set up, or something where you can show people that, listen, we are washing our dishes in a very heavy soap. It stays soaked for an hour, and or 20 minutes it gets soaked for, and then we wash it. So we're taking extra precaution to protect you. Things like that. Like every single business just needs to basically send a message to their customers that your safety is very important to us, and they take actions to protect them. And so they need to think that through. And it's very, very crucial if they do that, then life becomes much easier and they can start opening up. So right now, for example, most physician offices are closed and they're letting staff go. And what my worry is that a lot of these people are holding on to their health issues. So if I've got a bit of a cough or something, or my side is hurting, I'm not going to go and see a doctor right now because I don't want to take a chance. But if I know my physician, his practice is positioned properly to handle me where I will not get infected by anybody else. So if I know he's wearing a proper body mask so he can't infect me, and vice versa, that I can't infect him. And I'm the only one when I walk into the practice, I'm the only one walking in because the waiting room is a parking lot and where people are sitting in their cars and waiting for them. So things like that. So if I'm comfortable, I will go, which means they can start serving people. They can be one step ahead. And they can take care of people. So business can come back again, providing people are doing the right things in the right way. So I think, so small businesses, they need to be really careful what they do.
Dr. Sehgal, Mr. Kapil just raised that point as well. Do you think medical community is actually concerned about people who have serious underlying issues like heart issues or cancer or issues like that they're actually refraining from seeking medical advice, and that could actually put them at risk, and that could be different types of deaths that we could potentially look at?
Absolutely. That's been a concern. Some of the ER doctors in the US have noted, and again, this is all anecdotal at this point, but have noted lower numbers of people in the waiting rooms, less people coming in to be seen. And they've raised the concern that perhaps people that need to be seen emergently are not coming in. There's an anecdotal report I read from a cardiologist who said that he had a patient who didn't come in for chest pain, and it turned out to be, a type of heart attack that can be particularly deadly. And so definitely there is that concern. To answer about the cancer patients, again, there's been some reports of oncologists, especially in epicenters like New York, not or having to revise their kind of chemotherapy regimen to account for the fact that people are scared to come in. So that is definitely an issue.
Like I'm concerned for things like, for example, look at US. I'm really worried about US actually, because that affects Canada a lot. But the reason I'm concerned, for example, US is, and a lot of these things have not been thought through, in my opinion, that they've opened up, As a result, let's assume there's a second surge, and odds are very high it's going to be a second surge. And you have a second surge. In the meantime, remember, all these patients who were heart patients and cancer patients and all these guys, they've been pushed back. They say, hang on, guys, we are taking care of these people, you back up. So there's a lineup building up over here of folks who have a problem.
Yeah.
And then you've got a huge glut of people over here, which are with infections now.
Yeah.
And so you could be 6 months, a year down the road, you could be at a point where you've got a huge backup on both ends. And people are going to die who should not have normally died because of this infection of COVID. And that won't kill it, but their own health issues may kill them.
Mm-hmm.
And that's something you have to be careful of. So like even now today, our medical community, like our hospitals right now in Brampton, I'm actually, they're in very good shape because they're managing it. Like our council, our mayor has done tremendous job in controlling and, social distancing. Our province, our premier, our PM, everybody's done a great job in controlling that. But what they've also done is they have really controlled on the rest of the medical hospital and said, let's take all the emergencies, non-emergency stuff out. But that's backed up. So if they have time right now to handle that, they should actually open the doors and bring those people in and start handling them, because you do not want to build a backup. Because in case you have a serious surge, you're not causing a problem. And that worries me about US. Am I making sense?
Yeah, certainly people who are not, physicians and other healthcare workers who are not on the front lines, I think to a certain degree can help with that. Definitely telehealth has taken off. So seeing patients remotely, it is a challenge. So, for example, as a rheumatologist, it's very difficult, in my opinion, to do telehealth because so much of our, management depends on the physical exam. So I would imagine that other specialties and other physicians would have that problem too. But, whatever we can all do to contribute to taking the burden off of the hospitals, I think that would be a great, way to do it. And, some countries, for example, have dedicated COVID centers, which I think is excellent. And the patients that go to that hospital are only there for COVID-related illnesses, but there are other running hospitals that are for other elective procedures. And so, it has to be a balance, because definitely, when you have too many elective cases running through the hospitals and there's, infected COVID patients and sadly, potentially infected COVID health workers, you do run the risk, in my opinion, of infecting those patients too. But wouldn't it be great if we could use all these other modalities to take the pressure off our acute care facilities? And, certainly there are some elective procedures that can wait months. Mm-hmm. And it's not ideal, but they can. But there are some subacute procedures and, or subacute issues, and, we can't ignore those.
Mr. Kapil, talking about how our cities have handled, how do you feel the city of Brampton or the governments at a provincial or federal level have actually handled this situation?
I think they're handling things very nicely right now. I was very disappointed initially. I think they were a bit slow. Mm-hmm. They were probably slow for about a month and a half. Had they been a bit fast, I think we would have been even better shape. Like Canada is looking very good shape to begin with, because once they took action, they took very quick and swift action. Mm-hmm. And so all I'm saying is they delayed it. I wish they hadn't. Having said that, we can't change the past, but what they're doing right now is amazing. So at all three levels of government, they're doing an amazing job. Like one thing I would like to really suggest to a lot of municipal governments is they need to work with businesses, which I know like Brampton is working with businesses, but I think they need to go one step ahead with things like they need to set up a whole bunch of mini task forces. Mm-hmm. The council can help, the economic development departments can help, where they set up for each single industry. So restaurant industry have a committee, come with solutions now. So when we open up, how can we open up slowly? Come with recommendations, for the doctors. Like right now, I know we deal with primarily our businesses dealing with physicians. We give financial advice to them. And one of the problems I'm finding is a lot of physicians they don't have much to do. They're seeing 7, 8 patients. Now they're laying their staff off, and their practice, they have to pay the rent, and they have expenses as well, just like any other business, but revenues are not coming in. And they need to find ways. In the meantime, there's a backup building. So when they open up, they'll have a tremendous pressure to handle their patients and patient load. So if they can handle a lot of it right now, it'll be great. So they need to get together and have a little committee there and figure out, okay, how can we handle this? So I think our municipalities can help a lot there. And I think, so every single small business and large business, they need to set these little committees up, and hundreds of them, and set them up and help each business and plan it through, think it through. Okay, how can we help you? What are the steps you need to take? And come with some guidelines for all the businesses. Then come back and say, okay, well, all the restaurants, guys, you may want to consider doing this. Step 1, step 2, step 3, step 4, step 5, and have systems in place. Physicians, you need to do this. Dentists, you need to do this. Like right now, dentist practices are closed. Now people have got tooth pains, and those are the only ones who are going. But somebody needs a root canal, he's waiting.
Yeah.
And and in the meantime, dentist has got a major expense, so they need help. So I think we just sort of need to work together and figure out ways how to do it, even at this stage while we are.
Okay. Finally, guys, sorry, Dr. Sehgal, do you want to add something to it?
I definitely have seen, just from the medical side, just the PPE level, how nice it is to see companies, again, I want to reiterate that, on a grassroots level, helping to provide, equipment needed for the hospitals, helping to provide personal protective care. And it's done in a way that's quick. When they start manufacturing it, the healthcare workers, I like to see that they have to, they're always going to be worried about that, but they can worry less about that, about running out. And, so to have a constant stream of it, that also prevents infection in the hospitals, because if they have their adequate PPE, if they become asymptomatically infected, they're not going on to, it decreases that transmission. So it really helps on multiple levels to have business involved.
Any final advice, Mr. Kapil, for individuals who are sitting at home, isolated, or I don't know how, obviously US will be different now, but how can an individual help? One, to keep themselves safe, and secondly, how can they help to the community at large?
Well, first, I think if people can help at community at large with respect to food drives or PPE drives financially, please do that, because they need help. Now, if we are in a situation where financially we cannot do that, I think one of the biggest thing each and every one of us can do is share and educate your neighbors, your friends, your relatives to keep and respect social distancing, how it's important. Take time to think it through, look up on computers, call up some people, call people like myself for all that matters, if you want to do Facebook Lives, and and there are a lot of folks who have the information who will be happy to do that. So send them a small line, send them a message on Facebook, we want to do this, can you help us? And so we can set up some sort of things where people can learn. And I think that's the biggest help you can do. If you can stay indoors, or if you can respect social distancing, and you can get more people to do social distancing, I don't think there's a bigger thing anybody can do to have this particular situation right now. Because hospitals won't need PPE equipment if people are home until they come with solutions. Once they come with solutions, now we are fine. But to manage the problem, the only solution is you got to stay, you got to respect social distancing. You got to make sure you wash your hands. You got to use your mask when you're going out. You keep your distance when you're talking to people. All those things, whatever all those things are, and there's plenty of stuff available on the internet, and there's plenty of folks who will give classes on that. I think they should be like municipalities perhaps can consider doing classes every morning, where people can log in and see all the different classes with respect to, or all day long, quite frankly. It could be a recorded running where people can participate in these classes, so they can see what things are available, what are the social distancing rules. I think if we can master that, I don't think you can do bigger help than that. You don't need to pay any money, quite frankly. I don't need to buy, or you don't need to buy any PPE equipment, because we are home, we protect them, and that's good enough. That's the biggest help we can do. So that's all, the social responsibility.
Any final words, Dr. Sehgal?
Actually, I do agree with the importance of social responsibility, at this time. That's going to do multiple things. Staying at home is, going to prevent burdening your healthcare system. That's going to protect the workers in any healthcare facility, whether or not they have done surge protection. It's really up to us as a community to protect our hospitals and healthcare, facilities. And I do agree that, getting through this is going to be requires a unified community effort, mental health outreach programs, food drives, also to identify who's at, risk for food shortage, not just acutely, but chronically as this goes on. Education to me is critical, understanding how the virus is transmitted, understanding that there's limitations to the tests in terms of picking up cases of COVID. I think that that's very important because, and including updates on how, as research goes on, we're going to learn more about this virus and how it goes from person to person. And we need to update people on that because, that's going to help with city planning in any city. But again, the most important thing right now is to stay at home. That will help flatten the curve and also suppress the curve. And over time, once we see a prolonged suppression, once these other factors are in place, we can talk about lifting certain social restrictions in the future.
Of course, for now, let's stay home, stay safe.
And now we can't do it now.
Yeah, and I also, if I may add, I think it's important for all of us to let our leaders know that social distance is important. Please don't open, because they are getting a lot of pressure from people to open up. So something you want to keep in mind, you want to keep your voice alive. The ones who are sane, who are intelligent, who are not concerned about the greed, because there's a greed out there, and that is putting a lot of pressure on these politicians. And just like I was saying earlier, that basically, if they give every single American family $2,000 a head, that's $1.7 trillion or $1.6 trillion, for a whole year if they paid them. And whereas they have issued roughly $6 trillion of funding for this particular, COVID-19. So really, to normal person, you only see 2 trillion, roughly less than 2 trillion gone there. The balance 4 trillion has gone to corporate greed, in my opinion. A lot of it has gone to corporate greed because nothing happened. Like the very first week, people still had rent to pay. People still had money to pay the monthly mortgage payment. People still, the first month I'm talking about, when all this happened. But the funding came in very quickly in the US. And so I worry about that kind of stuff because the way the money is going may not be going in the right places. And we got to keep that in mind. And we as citizens, it's our responsibility to keep an eye on that, because that is a large chunk of money which is being used on and diverted to wrong places. And we got to make sure it doesn't go there, because we end up paying for it because somebody else wants to drive a Rolls Royce now, or somebody else wants to have a private jet now because they want to go to the washroom in Timbuktu. So I don't want to pay for that, is all I'm saying. Exactly. So we got to ensure that
it's our responsibility to be aware what's going on in the entire world, in our countries, and obviously keeping home is the best thing that we can do right now as individuals. And
like I said, I think the last time I was in an interview and I mentioned that one of Obama's advisors had mentioned, never let a good pandemic go to waste. And this is the reason. What they mean by that is that you got to take full advantage of the situation. There's a lot of money you can make in this. A lot of people can make money in this. And this is time to pay back your favors. And let's make sure that our leaders don't do that and they don't fall into that trap. Because that's what their leaders are. That's why I call them leaders, because they will stay away from this. I'm hoping they will stay away from corporate greed and not have the corporate greed, but worry about the people who vote for them, worry about the people who got them to where they are today. And I think that's what I think, and I'm very proud of our leadership so far. They're showing they've done a good job. Like Canada is a very good example, that all the programs are focused more towards majority of the individuals rather than the corporate world. And corporate world, where they're helping, they're also helping to help the individuals. So banks are maybe being helped, but that's to help me to defer my loan, for example. So a lot of things they're doing, I can see the connections coming in back to us rather than just corporate greed. So, keep the great work, guys, and that's all I can say. Thank you.
Exactly. Thank you, guys. I think it was very important to come together and have this conversation, and we'll obviously post this on our social media, and if there's any questions public has, they can be posted there. Thank you, and we'll be connecting soon again. Thank you very much.
Thank you. Thank you. Thank you.